A new policy change means thousands of people in Oregon could lose access to behavioral health treatment and their current therapists. CareOregon, a nonprofit health plan that contracts with the state, is changing its rules for Medicaid recipients under the Oregon Health Plan. Now, many people now have less than 2 months to try and find a new provider. Evan Watson joins us in studio. This must be devastating for a lot of people. How did we get here?
Yeah, it really is. A few years ago, CareOregon made a change. Specifically, the organization opened up its behavioral health network to meet a growing need, allowing payments to non-contracted providers and therapists. Now, CareOregon is closing that door. It means 15,000 people could lose coverage and some providers might have to close. It took years for Rashinho to find the right therapist who could help her with complex PTSD.
You can go through so many that don't fit and you try to make it work, but when you finally do find that perfect pair of jeans, that perfect provider, that mental health provider, you realize how comfortable and how beautiful, you look and can be and feel.
A CareOregon policy change, making non-contracted providers ineligible for Medicaid payments, means Rashinho and thousands of other Oregon Health Plan members might have to start over.
Finding a new provider, starting back from zero, going through the loopholes again.
Many therapists and providers say they're outraged and concerned. The policy change includes an October 1st deadline.
With only 60 days notice, it's an incredibly irresponsible decision that is completely negligent of not only of providers and our businesses, but of clients and their well-being.
With waiting lists and high demand, is it fair to say that many clients will struggle to find a new therapist?
Yeah, absolutely.
CareOregon says the change is needed to cut costs after Congress passed Medicaid cuts through President Trump's Big Beautiful Bill, saying the policy change will allow CareOregon to continue meeting the needs of our members under new financial constraints, including sweeping federal Medicaid cuts. We understand it is challenging to change providers, and we will work to minimize any disruption by reaching out directly to impacted members to help them transition smoothly to contracted providers. Chelsea Harrington, owner and clinical director of Bridges Therapy and a non-contracted provider, says her practice might have to close after losing more than 100 CareOregon clients.
So much of what we talk about in Oregon about our future as a state is increasing behavioral health access. And this is in direct contradiction to what that mission is.
Why can't a provider like you become contracted with CareOregon?
They haven't been open to contracting for years. Yes, they opened up their network because of the exponential increase in need for behavioral health services, but that hasn't changed. The need is still there.
Rashinho calls it gut-wrenching.
I feel that it will be on the fault of politicians, and it will be felt in our community.
The many providers and patients I talk to say it takes time to establish care and trust as well, and they're worried about the fallout when those relationships end due to a lack of coverage. We reached out to the governor's office and the Oregon Health Authority on this, but have yet to hear back from either of them.
Evan, thank you for that report.